Well, hi everyone. It's Pete here from the Pain Toolkit, and we're here on another Pain Toolkit Academy question and answer. The 27th of July 2025. Hey, listen, got some news for you first. Dave was going to be with us today, but he's woke up with some sort of summer cold, etc. So Dave won't be able to make it today. Keith's on his vacation time. He'll be back with us soon. But listen, I've got a fantastic guest with me, Virginia Mcintyre. Virginia, thanks for ever so much for joining us as a guest on the Paint Toolkit Academy Q&A. How are you today?
I'm great. I'm great, Pete. I'm joining here from Canada. I'm great, and thank you for having me. This is going to be a lot of fun.
Yeah, we've the feedback we've had so far, but since we been doing it, having a guest along, like it, people seem to like the concept. But listen, before we get into the questions, we've got some couple of questions left over from last week. Um, can you just tell listeners and viewers? Don't forget this will go on YouTube and SoundCloud. So listeners and viewers. Can you just sort of tell people who what you do? And I know you run a fantastic organisation over there. But hey, listen, you tell them what you do.
All right. Okay. First, I'll tell you what I do. So I wear multiple hats. I do live with chronic pain. I've been living with chronic pain since 2008, and as many struggled with a healthcare system that really doesn't get it. Really doesn't. After years, finally did get back to work and learned to manage my pain with a lot of the self-management. I realized people are struggling. So what I did is I opened up the People in Pain Network. Well, it was open, but I brought it down to the eastern part of Canada
Mhm.
and opened a support group. And we now have six, but I now run the organization, and so I'll tell you a little more about that, but I'll also tell you a little more first of what I do. I've expanded from doing that to being a patient partner on research projects, sharing the lived experience voiced on Pain Canada's National Advisory Committee, the Canadian Pain Society. I started their personal lived experience committee to ensure that the lived experience voice is integrated in everything they do. I'm also with the communication committee and the first Canadian with lived experience to receive the May Day uh, Society and Fellowship out of the States. So I do a lot of whatever I can to raise our voice and raise the
Wow.
self-management.
Yeah. Don't forget, I think the did you mention Action on Pain?
I did not, and I'm thrilled to share. Thank you for that. Uh, Myself and two other people who live with pain, Jennifer and Keith Meldrum, who was a part of Pete's Wonderful Work, are launching in September Action on Pain podcast. And people, you must listen to it. And this is really grounded on Health Canada's Action on Pain uh, plan that they had put out, and it's been now a couple of, I think, 2021. So we will listen to scientists, researchers, lived experience, and what's happening in Canada with
Mhm.
driving action forward. So I'm really looking forward to having that launch. We've been having our interviews already. It's going to be wonderful.
Yeah, seems to be that podcasting now seems to be the in thing. Like, I think it's so people can listen to stuff while they're on the move, and also useful for our people out there, healthcare professionals and people living with pain, who may have a visual impairment and stuff like that. So to me, I think it's really hot, and it's one of the reasons why we started up the Q&A, like, because there's the amount of questions that were coming in all the time, and I think, that people want answers from others who are like them. I mean, we had a guest, all the guests we've had so far have been healthcare professionals, OTs and stuff, and we've got some healthcare professional ones lined up in the future. But I think it's uh, because we experience pain and we're self-managers of it. It's that easy. I think sometimes that can be an asset for someone, like, because hey, yeah, listen, yeah, they get it. I can understand that. So. Anyway, podcasting. So yeah. Anyway, so what we do, well, I've got a couple of questions left over from last week's one, and we got a few more as well. But we'll see how long we go for. So they're only 30 minutes. The question one is from Adam, who's a healthcare professional, and Adam asked, "What role does a patient? What role does patient feedback play in ongoing development of self-management programs?"
Well, that one's probably the most important role is the patient feedback.
Yeah,
We know what we need. And like you said, people us coming together and sharing our experiences, we get it, we understand. So without that patient feedback on the tools they're developing or in the patient's progress during their self-management, you're not going to move forward. You
yeah,
have to know where the patient is at and how the patient feels and what works. And not just one person. You have to listen to every patient that comes through that door because we all have different experiences and we all come to the table with different perspectives, backgrounds. So it is the most important role is the
yeah,
patient and to listen to the patient.
yeah. I always get reminded from years ago when someone said to me, especially me, like when I was sort of early days of recovery, really, he said, "You know, your problem, Pete, you've got too much to say for yourself, like, you know." They suggested I take the cotton wool out of my ear rolls and shove it in my mouth and listen to learn and learn to listen, like, you know. And that's what I did, you know. But the feedback from us, like, it's I think it's paramount, really, because. Um, we, as you say, we got everybody comes from different backgrounds. We've all got different stories. Yeah, sure, we all live with persistent pain, but you know how we live with it, where we live, what occupations we have, if we're working, social environments, stuff like that. Sure, you know, the common denominator is pain, but all this other stuff has an impact on the person as well. Like, you know. But for developing ongoing programs, it's about, well, what worked and what didn't work, like, you know. And I think one of the big when I worked on the NHS expert patients program, you know, we always used to have a debrief at the end of it, you know, where the patients had gone, and the tutors would sort of sit down and we all, you know, sort of discuss, well, how did that go? You know, what worked well, what didn't work well, what do we need to improve on, like, you know, what can we learn from it, like, you know. So, but I think self-management programs are developing all the time. I mean, well, even pain management programs, because there doesn't seem to be. I don't know what it's like over there in Canada. You know, we've got different types of. Say when I say different types, different lengths of program. There's like the input program I went on, which is an inpatient one. We got that used to be just a 2 week one. Now it's 3 weeks. Now then, there's all these other ones, that outpatient ones, pain management programs. Some are 10 week, 2 weeks long, 6 week long. You know, and you know and also the online stuff now as well, because of COVID from back in a few years ago, it forced everybody to do stuff like this online, etc. You know, to do self-management programs, etc. You know, and like well, with us with the academy, you know, that's an online the academy was developed really for those who can't get on a pain management program. You know, if they live in a rural area. Well, take where you live. Is it Nova Scotia, isn't it?
And I'm rural Nova Scotia, and like I had shared with you, our pain clinic, our specialized pain clinic, is it's a 5 year wait to get into it. And the same thing, they have the self-management classes, which are essential. But you're right, the online are important, but patients need to know what online resources are there that are
Yeah,
evidence-based.
yeah,
They need to be shared, and that has to be given to them. That's why we run the support groups. And a very unique support group that it offers the self-management piece with the education, which is all evidence-based, with facilitators who are provided and equipped with the skills they need to help others. So you need to know outside of the clinics, because we all assume that within the clinics, when they're offering these self-management classes, that they're evidence-based. And I would like to assume that within pain clinics they are.
Mhm.
But outside that, that what you're getting is evidence-based and it's valuable. And what you do and what we do is, and we have things like Power Over Pain Portal that has that online resources. But people need to be mindful of where they're going for the things with their self-management and their education piece, that it is all evidence-based.
Can I ask you a question? So though for those people that wait 5 years, uh, before we started, you told me 5 years. I did sit back in my seat a little bit. I've never heard of them that long. I met, funny enough, I did meet, I did some work from people living in Ireland a couple of years ago. One lady there said she had to wait 7 years to see the pain doctor, so what? So it's a 5 year waiting list, and is there? Have they ever thought of doing like providing like an online course that they could, while they're waiting, could they do an online course?
I,
Uh, I'm thinking, I'm not talking like the Pain Talk Academy, so they're learning something while they're waiting, etc. So before they can get on a program, is that do they run those sort of things?
I think they're doing some online self-management classes as they do in person. And I know the Making Sense Out of Pain program, our community pain clinic, the small pain clinic, which really is
Mm.
closed because they can't staff, are running that. But offering things like the Pain Self-Management Academy, are they doing that? I don't know, Pete. Some of our clinics are talking about our peer support programs, which offer the connection and the education piece, but some aren't. Are they taking the time and offering, telling them about these things and Power Over Pain? Um, you know what? I think some are, but I would say the most are not. And it's unfortunate because there's things out there on self-management that people can use, especially as they're waiting. And I think the healthcare providers miss that. If people start using these things, they may be able to empower themselves a little bit more, that they may not need the healthcare providers, or not as much from them. When they get there, they have a foot up already.
Mm. Myself and Keith, we I don't know, we have little chats from time to time, this is a few years ago. I was talking to Keith about prehab, and because a lot of people know, I live with cancer as well, and there's an organisation down in New Zealand I hooked up with called Pink and Steel, and what they were running, run by a physiotherapist, but what they would do is they would run programs for people who are freshly diagnosed, like a prehab one, a program during cancer treatment and after cancer treatment. But I hooked onto the prehab idea. I think, well, surely once something, because of waiting lists, there's waiting lists all the way around, around the world. But so while people are waiting to have some sort of procedure uh, why don't we, why don't they do something around prehab? So I think it's back in 2023, myself and Keith, we got a few other dudes involved as well. We adapted the pain toolkit for prehab.
Brilliant.
Yeah, so if while they're waiting for like a knee op or something, or any sort of procedure or whatever, so they get instead of because there's rehab in here. So why wait until you've had your procedure or op or whatever where it's going to have. Why don't you learn it beforehand so that it cuts down the recovery time? We just thought so
In
yeah.
those programs, PT, you talk about, which I think would be very beneficial, like mine was a post-surgery pain and how it stayed on. Do you talk about those so people can have the flags to get something done and know what to do about it? And
Yeah, it's all just well, what can they do? I mean, I always remember healthcare professionals, where people say if they did something. I'll tell you, it was a Canadian doctor, Dr. Mike Evans, and he said if you can do something. I used to watch his video, Canadian doctor, a Canadian GP, and I learned so much from that guy. And he always says that, before if you can do something, prepare for the knee operation. I think the video was about a knee operation or hip operation. but what you could you do beforehand, like, because I think in healthcare a lot of times it's a bit it's like a firefighting service, it's like a fireman turning up to a fire and see a lot of smoke coming out, but they say, "Don't worry, boys or girls, we'll wait until it bursts into flames and then we'll go in."
The fire. Yeah, no, nothing around the preventative piece.
Oh yeah, it's like become a firefighting service. Oh, we've gone. God, it's been an interesting answer to the question. Sorry, Adam, we might have gone off track there a little bit, but self-management programs, there should be more of them, mate. It's as simple as that, and it's a developing them. Those out there who will want to develop self-management programs for not just pain but long-term conditions or anything like. Keep it simple. Don't overcomplicate it. This ain't rocket science. So anyway, Adam, I hope you found that useful. Well, I'm going to go on to the second question now from a person living with pain called Joey, and he asked, "Can participating in a self-management program reduce the need for pain medication?" It's a little bit of a tricky one, this is, because if you probably guess, I've got a stethoscope around my neck, was Norwich, Virginia. So we're not,
Exactly. Well put.
yeah, we're not healthcare professionals. Um, I always say I'll get on a self-management program, but from my personal point of view, if you want to reduce the reduction of any medication, but you must do that under the supervision of a person who knows about Medicaid, like your GP or a pharmacist or someone like that. You need to know, to see a professional about that. What's your take on that?
I say the exact same thing. See the professional. I mean, what you do with the pain toolkit and what I do with the self-management through the support for the peer support, we complement their work and we're an arm of it. And, as it is the stepped care 2.0 model, we're not replacing it. So we cannot do that part with the reducing medications. Do it with your physician and tell them you're taking on some self-management pieces and how it can be all work together. But
Yeah,
definitely you got to keep your physician or your pharmacy or your clinician in the loop
yeah.
always.
Remember when I was on my pain management program, we used to see the pharmacist. It was a 2 week course, but I used to see them several times as they was always talking about reducing how we felt about reducing the medication, and it took me, I guess, for me anyway, it took about a year for me to come off meds. I was pretty still reliant on them, like for me back pain or whatever back then, and but so I haven't. I suppose what I did, I swapped because I learned how to through exercise, regular exercise, or meaningful movement, as they call it now. Um, I swapped taking medication for regular exercise for me, all the while I'm stretching, exercising, and doing all my other bits and bobs like yoga and Tai Chi and Qi Kung and stuff. I don't really need to take any meds. I always remember I used to get really bad headaches, and but as soon as I started getting into regular exercise, they dissipated, So
And I think that's where the self-managed piece comes in is how to do this movement, the meaningful movement. I mean, I used to be a marathon runner, so I can't do that anymore. But with pacing and stuff, I still can move and I can still walk and learn to avoid this boom and bust all the time, and then was also able to reduce my meds. I mean, and some people can reduce them, some people go off with them, and some don't come off them. The big thing is that
yeah,
you're moving and you're having a quality of life.
yeah. I think what I learned from Keith is neuropathic pain. I think that people may have to stay on them for a bit of time. I don't know, but it's all down to the individual. Like
And that's okay.
yeah, there's no shouldn't be demonized for, oh, you're still taking pain medication and stuff like that. But
Yeah. I mean, why aren't they asking, are you getting out for a walk? How's your life? Are you able to, I have grandchildren, like I share with them here with the grandchild. Are you able to participate in your life and do things that you enjoy? That's what's
yeah,
important.
yeah. It's all about getting your life back on track, really, and return to things that you want to return to, and try out new things. I mean, that's the beauty of self management is sort of getting your life back on track and uh, you know, say just I don't know, giving me my mobility back. Like I was like so restricted. So frightened to move. Better not do. Oh, better not do that again. It's put my no go list was massive. And yeah. So that's what I enjoy about being a self manager is having the freedom. I can go to places now. I mean, I've been oh, it sounds a bit. I won't go into that. It sounds a bit. I've been a bit big-headed, but I've
Yeah.
been around the planet and stuff like that. I mean, it's all through the help of self-management. That's why I'm always grateful to the input program because they give me my life back. Really, I know that sounds a bit dramatic, but they really did. Simple.
But don't you think it had part of learning what persistent or chronic pain is and knowing about the system and
Yeah,
and that was huge. Oh, yes, I can move a little, but that's not going to make it
yeah.
worse.
I mean, back then I thought my life was over. I was only 40 odd years old, early 40s, and I really thought this is it. Is this what my life's going to be? But I'm in my early 70s now, and I'm having the time of my life. I was out me motorcycle yesterday, and yeah, going here, there, and everywhere, and got a little camper van now. I'm planning to go out and explore a little bit and having a bit of adventure with that.
Right.
And that's all down to self-management. But you got to do it. It's not a with self-management. It isn't like I always say it's like well, dear Arnold Schwarzenegger, read your book now. Send me the muscles. So it's a doing thing. It's not a oh well, yeah, I'll do my stretching next week or tomorrow or the day after. It's like brushing your teeth. Really, it has to become a habit. And but when you do, I don't know about you, Virginia, but things be happen beyond your wildest dreams. You get your freedom back. You're out of jail.
And it may not be what your life was before. This is not
Oh,
the
yeah, it's better.
it it yeah,
Yeah,
life yeah, but it is learning how to do things living with
yeah,
pain.
yeah, yeah. But you got to do it. It ain't gonna happen. It's not like popping a pill and stuff like that. You get some sort of may get some instant relief, but doing self-management, just putting including it into your day. That then you can do whatever you want, So anyway, Joey, hope that's answers your question. Another one from a healthcare professional. We're going for time. We got all right. Well, okay, got 15 minutes. From Val, she's a healthcare professional. Or say Val. I know some guys are called Val, and I've heard that before. I don't know, Val Doonican. I don't know, you probably won't remember. He was an Irish singer. Anyway, Val, if you're a man or a woman, whatever. But um, how can healthcare providers identify and address the patient's emotional and well-being in a pain self-management program?
Well, this is an interesting
Yeah,
question.
yeah, yeah. I'll tell you, these questions, I'm digging them.
You know what? I just love it. I love that the people are engaged and are sending these type of questions.
Yeah,
First
talk
part,
about
how do you address a person's well-being is you got to listen. I
yeah,
mean, to identify it, well, the first to identify, you have to listen, you have to validate, and you have to really listen to what's going on in their life and their well-being. And then, and you have to be able to support them in these things and how to improve that, with social, with everything, they need social connections, they need coping skills, they need strategies to help them de-stress and tailor the needs to them. And you're only going to know this by really listening to them and ask questions. Be curious.
yeah, yeah. I like that. Yeah, yeah. The emotional, pain it is an emotional experience. I don't know anybody that wakes up in the morning and say, hey, I've got persistent pain here. Great, isn't it? Yeah, yeah. It's it brings up all loads of emotions. Low mood, depression for a lot of people. Um, and
Lady.
also, I think we have to remember that persistent pain has an emotional effect on the family, like, because that you think, especially the partner, they think, oh blimey, I didn't think this was going to happen. They didn't sign up for this, and so the partner who may have to become the breadwinner, um, where the roles reversal and stuff like that. But the emotional side of it, and for me, I remember I was having a roller coaster uh, emotion, regarding it was like being on a roller coaster. I was depressed. I was angry. Why me? I'm not an horrible person, and
Yeah.
people would try and cheer me up and stuff. I nearly swore then, but it just the emotional side of living with pain. Uh, it's a dolly mixture. It's like there's so many parts of it. Like you can't. There's no joy in it whatsoever. Like it's funny. Before this afternoon, I was reading about someone on LinkedIn wrote a piece on about people who don't get stuck, who get stuck, and a lot of people don't really want to get well. Like and I think there are some people out there who get a little bit stuck and. Uh, for whatever reason, like but I think they're very few and far between. But when the people that you probably get yourself, Virginia, the people that contact you, like they're desperate.
And I think that's the key, Keith, or Pete, sorry, Pete, that they're desperate. I mean,
He's got hair,
that's the difference.
and he's not, and he's not going grey yet.
Doesn't have that accent, lovely accent.
Uh,
Uh, but it's a desperate. And when I was at my point of the worst, I was desperate. Um, but not knowing what was wrong with me made it worse. Not knowing why this pain was after a shoulder surgery that the surgeon kept saying went well, and I was supposed to be better, but I wasn't. But
yeah,
you're now in the cycle of healthcare providers, people not believe in you, your connections, your friends, nobody there to support you, being dismissed, being called. I was under insurance company, basically said, "Do you want to work?" Not thinking you want the easy way out. So the emotional cycle is hard, and being stuck. It's hard not sometimes to be stuck when nobody's there to support you. And I say to Fizzy when I speak at one of our universities here, I say, and I think this is a great question that this healthcare provider brought forward, but I'll say to them, this person in front of you may be in a really bad place at this time, and it may not because of you, and you're not the one who's just dismissed them
mm,
and believe them, but they could be for days, weeks, months, for me, years, and jump through a healthcare system and insurance companies and friends and workplace who have dismissed them and not believe them, that you're
mm,
always proving yourself that I am worthy, that no wonder they're stuck, no wonder they're hurt. But you have a chance now if you're sitting in front of them to validate and to listen to them and help make a difference.
yeah, yeah,
They're not just wishing to be here. Things have happened to them to make things worse
yeah,
sometimes.
yeah. Yeah, I'd say like the emotional side of it is another big side of it as well is loneliness. It is very isolating.
Isolating.
I was at a time when it was a bit dark days, so I was living on my own, and or we used to see, people had obviously had the telephone, but people would ring out, but they wouldn't. I had nothing else to talk about, but was my back pain. So a lot of people stopped. I'm not. I don't blame them. But they stopped ringing because it was depressing for them. Like I guess
We hear this all the time.
the loneliness, the isolation of living with pain because you've perhaps been with that active person where you've been able to go out and be places and stuff like that. But pain brings the immobility side of it,
Yeah.
losing your confidence to go places. But I better not go that. Well, last time I did that, me pain, I had a setback for me from having and I'm not going to do that again. So you can't do list sort of increases, and in the end, you just I always remember my life was based around what was on the TV. Really, I was just TV programs and stuff like that. But yeah, I mean, it's just I'm not sure if that is acknowledged quite a bit. I don't know what it's like over there, Virginia, like with the emotional side of pain. I mean, do you get a lot of that with your groups?
Yeah, but this is universal, the emotional side. And
Mm.
people, I mean, people come to our groups and they're saying, oh my gosh, I've been living with pain for this long. And now the first time I felt validated or listened to, or someone believes me, and they'll call it like our home base. But even people who kind of get to a place where you and I are, um, can often still find themselves a little isolated. And that's why these groups are so important because, or knowing people who live with pain. Like if you and I had, say, if I was living over there and we said, oh, let's go for coffee.
Yeah,
And the last, and I said, Pete, can't. I'm having a flare up. You'd say, okay, I'll catch you next time. But what often happens is because people don't understand it and it's not somebody else who lives with pain,
yeah,
again, they stop calling, they stop
yeah.
coming. And that can still happen because
And,
it's happened. So it can be isolating and it, this is, I talk to people and you do from everywhere. This is a global problem.
yeah.
Yeah.
Look, we've got one more question. This is a great question from Claire.
Okay.
It's a nice, an unusual one, to bit of a cheerful one, I guess, to end on. Claire says, if pain management were a superhero, what sorry, if pain management were a superhero, what would its superpowers be?
What an incredible question. Well, kudos to Claire, and I hope you're listening to this. Listen to it. This is a great question.
Right,
Pain man,
digging it. Yeah, I love it.
empowerment. It's
Yeah,
empower. It's, no matter where you go and how you manage your pain. And like, okay, so I can't run marathons, but I can run a few kilometers. I can get out. I can hang with my grandchildren. I can do stuff. It's empowerment by self-management. I can still do things that I love. You can get on your bike and go. You may not be able to go bike all day. Your back might, but you can go for learn to do bits here and there. One of the girls go to our support group when she goes away for Christmas and it's only a 6 hour drive. They will stop every couple hours. You learn how to do it. And in fact, she gets there. We get where we want to be. It's
yeah, you
empowerment.
adapt. Yeah,
What
yeah.
would you say?
My superpower, I call it freedom. Really, going back to what I said earlier. So superpowers will be freedom because the freedom that I have it's given me over the years. To go places where I never thought I'd ever. Uh,
Love it. I have a question for you. Can I got time to ask you a question?
yeah,
Pete,
go
you
for it.
long time. And when I took over the People in Pain Network, Pain Toolkit was really the basis of what we do, the steps to self-management. Have you found over the years you continue to learn from
Oh,
other?
yeah, yeah. I'm learning every day. Yeah, you can't. I remember read a little saying years ago, and when you wake up in the morning, you ask yourself, today, will I be a teacher or will I be a student? And every day I'm a student.
I love that.
Every day I'm a student because you can't. So to me, this is an on. As as I've become an older person, it's about adapting. I've had to change things.
Yeah.
I still got, still doing the basic stuff like pacing and keeping active and stuff like that, relaxation. But I'm always on the lookout for things in a better way, or how can I adapt for how limiting my health, long-term health conditions and pain sort of stuff. And I'm a big I got into Instagram, I guess, about 2, 3 or 4, maybe, I don't know how many years, especially last 2 or 3 years, I really got into that big time because there's so much good information. What I like about Instagram is short, sharp information. And because I'm a bit of a, I'm a, I'm a thought some. That's what when I'm on the bike says when I'm stopped when I'm on my motorcycle. I call him my therapist, like because I'll have to concentrate on the road and car drivers and stuff like that. Anyway, it's another story. But no, no, I'm always learning. I have that thirst for adapting to things, and I love learning. Learn do things differently. Got into got back into like qigong, which is a form of tai chi.
Yes, I've done
And
that.
it's like when you click something, you like something, then you get deluge of stuff like but doing some different versions, movements in qigong have really helped me along the way. But yeah, I mean, and you'll find out. I mean, you're still a young lady, and you'll find out as you become an older person, or head. Always there's things heading around on your Instagram at the moment. Say if you're in your 30s and 40s or whatever, you need to start preparing for the older years, so all these activities become um, the norm, you haven't got to think about them. But no, I'm always learning. I love learning. I learn from other people.
I,
You are my teachers.
that in our support groups, I learn more from them who come around to
Yeah,
our meetings, sit there and share how they're doing stuff and how they're coping and their
yeah,
stress. I continue to learn. I'm like, oh, I'm going to try that. Yeah.
yeah. I remember my next door neighbour say to me years ago, every day's a school day.
So
Yeah.
wait,
Hey, listen, the time's caught up with us here. I've really enjoyed this. Yeah, would you like, no pressure at the moment, but you fancy coming back later on in the year to being another guest when the guys are back and everything? Yeah, we'd love to have you back.
absolutely. Pete, I love coming and chatting with you and your work you're doing. I would absolutely love to come back. Thank you so much for having me.
Don't forget we got the Pain Toolkit conversations. I think that's in October. It reminds me I need to send out a reminder about that. But because I learn, see, when we do our conversations with all the other guys from, all the other self-managers from around the planet, that's a great event. I always come back from these with a lot of wind in myself, thinking, oh yeah, I forgot about that and whatnot. Anyway, I'll let you get on with your Sunday. What time is it over there, by the way, at the moment?
1:45. So
I'll
it's still
probably enjoy your afternoon.
it's beautiful warm day here.
Yeah, yeah, ours is sort of a little bit overcast, but anyway, I can live with that. Virginia, take care. Be cool and grooving. See you later. Ciao.
Take care, Pete. Bye.